Hi, it's Derek Gelderman here, and today we're here with Cooper. Cooper's a lovely senior boxer. He's about 9 or 10 years of age, and unfortunately he's got a multitude of problems. If you remember a couple of weeks ago we did a video on Wandering Jew. Well, if you have a look at Cooper's skin here, he's got really bad skin, and when I do this you can see how the skin's wrinkling and how itchy he is. Well, he is a Wandering Jew allergy puppy dog. Now, the people live on a very large acreage, and so it's really hard for them to keep Cooper out of the Wandering Jew, and every week or two he goes back in there. It's also very hard for them to kill the Wandering Jew because they've got such a large property. So that's problem number one. He keeps coming in with that. If you have a look, he's not standing properly on this leg. You probably saw he just limped a little bit as he's walked off. You can see he's limping there now. That's because Cooper broke the tibia about 3 months ago. He did what we call a greenstick or a hairline fracture just below the knee, in a place almost inoperable, and we didn't have to operate because it was only 3/4 broken. So that is still mending, but again he manages to get out of his confinement occasionally and run around like a Looney Tune, and he re-injures this leg. But it's getting better. Now to problem number 3, and that's this penis here. And if you have a look, that's a tumour on the end of his penis. Now, I saw the Cooper's owner contacted me about 3 weeks ago, and at that stage the lump was the size of a 1 cent piece, so about as thick as a 1 cent piece and the diameter of a 1 cent piece. Then I saw him about 10 days ago, and so it was last Sunday actually, so that's 8 days ago. And the tip of his penis then was the size of a marble. And if you, I don't know if you saw or not, but there's a suture here. I did a biopsy on his penis. Now you can see today it's the size of, a squash ball, okay? So it's gone from a marble to a squash ball in 8 days. The histo results, the biopsy results came back saying that is a mast cell tumour or mastocytoma. They're one of the more common tumours of boxers, and I think it's fair to say that they're the most common tumour of boxers, and about a third of boxers will end up getting one. It's one of the terrible diseases of boxers. Mast cell tumours are horrendous, they're horrible. And when we did the biopsy and graded this, then it showed that it was a high-grade tumour. Now his lymph nodes are glands, so you've got lymph nodes in the groin. In ladies with breast cancer, they'll check the lymph nodes in the armpit. That's the first place the cancer would spread to. A tumour like that would spread to the lymph nodes in his groin. His groin is clear, the lymph nodes are clear, so it's worth treating him. But it's going to be a challenging disease to treat. So there's a number of things we can do to treat mast cell tumours. If you can chop them off or cut them out, brilliant results, absolutely superb results. Now, it's quite easy in a dog like Cooper, or in any dog, to actually remove his penis, or remove the tip of his penis or his sheath, and shorten his penis and shorten the sheath, and have him have a normal, 100% normal, happy life with just a short penis. But I didn't want to do that at the moment because the tumour is so aggressive. To go from like this size to this size in 8 days, I'm worried that it's actually that I'm going to miss some of the tumour and leave it behind if I do that. And so what we're doing now is we're putting on some very, very simple treatment to shrivel that tumour down so that I can operate and get what we call clean margins. In other words, I can take it all out and not leave any tumour in the surrounding tissue. So he's on 3 drugs. One is a drug called Palladia, and he's on cortisone, and he's on a drug called vincristine or vinblastine. So that's what he's here for today. he's having his first vinblastine injection, and he's going home with cortisone tablets and Palladia tablets. Now, he's going to be coming in and getting injections, the vinblastine injections, once a week for the next 4 weeks. And as he comes back every week, we'll do a review of him and I'll show you what's happening. And then when we do surgery, I'll show you that as well. So I'm hoping the surgery will only be amputating a bit of the sheath and reconstructing the sheath so that he can urinate normally. But it may be a little bit more advanced than that. If it is more advanced and involves shortening his penis and shortening his sheath as well, I'm sure you'd be interested in seeing that. That's quite an interesting surgery. So all is not lost with Cooper. He's got a good prognosis, good to guarded prognosis because of what he's got. It's in a horrible place. If it was somewhere else, we would have cut it straight out. But because of where it is, it's a little bit more challenging. So plan of attack is to shrivel it down, and then the next plan after that is to cut it out. So I'll keep you up to date, and I'll see you in a week with a review.